Hi, my name is Dr. Richmond Lowe and I'm the fish vet. Today we're going to make a revisit of a patient, an Oscar fish that we saw 7 months ago for an eye removal. However, the owner has recently noticed, so 7 months after the surgery, that the orbit, the soft tissues in the orbit are starting to look irregular and it's also bleeding. So we're here to investigate the reason why this is so. And I also managed to dig up his old eye. So if you're a bit squeamish, you may not want to look away, but this is the Oscar's eye. Originally I did offer to submit this for laboratory testing, but due to cost being prohibitive, the owner has declined. So I'm thinking it's possibly while we're going to test the tissue samples that we're removing today, we should be testing this eyeball at the same time. It's gonna splash. Okay, let's put it in our anesthetic solution. While our patient is being anesthetized, just going to show you how we're going to set it up. We've got our sort of surgical table, which is made of just a normal plastic fish tank. We're going to be putting him on here once he's anesthetized. I'm just going to test we're going to do a pinch test to see whether he can feel any pain, to see what level of anesthesia he's in. You can see he's already slowed down. He's allowing you to sort of touch him before he was sort of splashing around. It allows you to put him upside down. His gill movements have slowed, so we know we're pretty much at the surgical plan of anesthesia. But the other check that we want to do is going to do a pinch test. So if it doesn't flinch like now, that means we're ready to go. Just put gloves on my wet hands, which is the most hardest part of this whole procedure. It will work. Now with our patient on the surgical table, we're just going to take off the excess water that's collected in the orbit. Now we're going to remove some of this tissue for histopathology testing. It's quite difficult to get in there. We don't quite have the surgical instruments with the correct curves. This is a curved scissors and we're doing the best we can. Now we're going to put this into formalin so that we can do some laboratory testing using the histology technique. So that is the preservative. We're just going to add a bit more anesthetic to the gills to keep him under for the next part, which is cryosurgery. We're just going to mop up any of the excess water in the orbit for this cryosurgery because we want to have the freeze action directed just to the tissues and not to be spread all over the place. And also we don't want the applicator becoming stuck to the tissue. When we're using the freeze spray, we make sure that the bottom part of the sponge is filled with the liquid. We don't want any bits dripping onto our fish, so we spray it separately. We're going to apply it to the wound or the tissue that we want to kill for about 5 seconds. We don't want to leave it too long because the distance between the surface of the orbit and the brain is very close, so we don't want to give him like a brain freeze or something worse. So now we're just going to apply to the other parts of the orbit, ventrally and to the sides as well. At this moment we don't know what we're dealing with. Is it a cancer or could it possibly be just granulation tissue that's become more vascular? When I continue applying more anesthetic solution, we know that in terms of pain, fish cannot feel cold as a sensation for pain. They can feel heat, mechanical injury, chemical injury, but not cold. So I guess using the freeze applicator, I think that's a good method to use whenever we're trying to remove lumps. Following this, we're going to apply some antiseptic locally onto the surface. We'll apply an eye ointment followed by our fish bandage to make sure that the antibiotic will remain in place for a more extended period of time. Just going to sort of smear that around, make sure that all surfaces are covered to prevent infection setting in. Okay, now that we're finished, we're going to wet our hands, our gloved hands, and we're going to put him back into our anesthetic solution. And the reason why we're putting him back into the anesthetic bath is so that it's much easier when we're going to give him the injections. Okay, now we have measured his body weight as 1 kilogram, which is about 2.2 pounds. It makes calculations a lot easier. We're going to give him 3 sets of injections. The first lot is an anti-inflammatory because this is a painful procedure. We're going to use flunixin at 0.25 milligrams per kilogram body weight. And then in terms of antibiotics, to make sure that we don't get any secondary bacterial infection, we're going to use enrofloxacin at 5 milligrams per kilogram body weight. And because he hasn't eaten in the last week, I'm not sure exactly why, we're going to symptomatically treat him with anabolic steroid. The one that we're using is stanozolol, and we're using that at about 2 milligrams per kilogram body weight. All these medicines are injected either in the peritoneum or intramuscular.
So basically we're using the outlet, water outlet, as a pump. We're pumping, flushing out all the anesthetic that's in the system that is breathed in. Speaking of which, if you were doing some sort of a surgery and you did run out of power, what you can do is you can actually have your fish, if you want to revive them, you have his mouth open and basically just sort of ram the water past his mouth by moving him sort of back and forth through the water column. Another way you could do this is you could hang a bucket high up on a shelf and have a tubing and use a sort of a siphon action to get the water flowing from the bucket down into its mouth.
Just reviving our patient, I've noticed a blood clot hanging from the socket. We're going to remove that with a pair of scissors, being careful not to disturb the actual clot itself.
Unfortunately, I have some sad news to share with you about Oscar the fish. He passed away about 10 days after the second visit. The following clips are histological images of the eyeball that was removed 7 months ago, and it shows clear evidence as to the possible cause of death.
Here is his histology image made from the Oscar's eye. On the right border, you can see that's the corneal lens. It's slightly thickened, and there's a lot of vascularization on the inner border. And at the bottom is the sclera. You can see the cartilage border around it. And in the center, where it should actually contain just vitreous humor and aqueous humor and possibly your iris and lens, it's actually completely obliterated and filled in instead with these blue cancerous cells. And in some parts of this cancer, you can see this in the center here is a lake where it's pinker than the surrounding tissue, and these are areas of necrosis, which is pretty much rotting of the flesh. And you can imagine that the eyeball is a confined space, so if the cancer wants to try and grow, it will put pressure on the blood vessels, stopping blood flow to the area, and these cells will be starved of oxygen supply and nutrients, and so they start to rot away. Now we're moving to the back end of the eye, where you can actually see the optic nerve, which is this long structure here. And if we go have a close-up look, there's also a lot of inflammation in the optic nerve. And then the next picture here, you can see that actually outside of the sclera, the border of the eye, you can actually see some of these small, tiny islands of the cancer cells. So by the time we've done our surgery, It looks like the tumor cells had already spread quite far and wide. It's no telling how far it's gone, but we did improve his quality of life for a moment because we were able to remove the largest source of inflammation and swelling in this fish. So I have some bad news to share, is that our Oscar the fish, he didn't make it. He survived about 7 months, and then he took a turn for the worse, lost his appetite, and had to be euthanized. Unfortunately, there's no cure for this sort of cancer, and we were unable to save Oscar. It is possible that earlier removal of the eye may have prevented the spread of the cancer. However, we cannot be sure that the cancer hadn't already spread before there were clinical signs of disease. What I can say about the owner is that he really cares about his fish, and I have to give him credit that he called out a veterinarian to come and do the best that he can to try and save his pet. What I can be sure of though is that by removing that swollen eye, we're able to remove the source of pain and suffering for the Oscar in his final months of life, and possibly extend his lifespan. Thank you for watching. Make sure you subscribe to get updates of our future videos, and have a fantastic week.